Welcome to our updated for 2019 version of our presentation, Understanding Your Medicare Options, presented to you by myself, Fanny Pacheco, and Kim Caldwell from PBI Insurance. At PBI Insurance, our primary focus is to provide healthcare solutions to seniors. Essentially, we can answer any and all questions related to Medicare. Our passion is making sure that all Medicare beneficiaries clearly understand the options that are available to them and how best these options work for you. We bring to you over 12 years of field Medicare plan experience. We've proudly assisted hundreds of Medicare beneficiaries all over Northern and Southern California.
We will cover a little Medicare 101. Some of this you may already know, but we feel compelled to go over it again since there are, in fact, a lot of misconceptions when it comes to the basics of Medicare. Our 101 will include what Medicare is, the components, how and when to apply, and the costs. Once we've given you your Medicare 101 refresher, we're going to dig into your options. Medicare is not a one-size-fits-all. There are 3 options that should be considered by you as an individual in order to select the right coverage option that fits you from a health, wellness, and financial standpoint. There are a few components we will dig further into, such as Part D, Medicare Advantage, and Medicare Supplement plans. We will also discuss how using a broker can assist you through this whole process. We want you to be aware that you're not alone in making your Medicare decisions.
What is Medicare? Now that Medicare is going to be a part of your life, we thought you should be aware of these background facts. Medicare was founded in 1965, an easy day to remember since you're eligible for Medicare at age 65. Medicare's first enrollee was President Truman. He was also the first to receive a Medicare card. Medicare is run by the Centers of Medicare and Medicaid, also known as CMS. 11,000 people turn 65 every day in the U.S. And it's also quite amazing that there are over 55 million people currently enrolled in Medicare.
Let's first discuss the components that make up Medicare. A and B are what is generally referred to as original Medicare. Part A is hospital insurance. It helps cover inpatient care at hospitals. It helps cover skilled nursing facility, hospice, and home care. Part B is your medical insurance. This helps cover physician services, hospital outpatient care, and home health care. It also helps cover many preventative services to help maintain health and keep certain illnesses from getting worse. Part C, also known as Medicare Advantage, is a health plan offered by private insurance companies approved by Medicare. These combine the benefits and services covered under Part A and B, and in many cases, Part D premiums. This is one of the options we'll be digging into later on in the presentation. Lastly, there's Part D, Medicare prescription drug coverage. This is also offered by private insurance companies, Medicare approved, and it helps to cover the cost of your prescription drugs. Medicare components and costs. Medicare Part A, hospital coverage. In 2019, Part A has a per benefit period deductible of $1,364. And remember, you can have multiple per benefit periods in a year. Medicare Part B, outpatient services. In 2019, Part B has a monthly premium range of $135.50 to $460.50. These are the premiums for Part B and are based on your modified adjusted gross income from 2 years ago. Medicare Part B covers 80% of Medicare approved fees billed by your providers. You are responsible for the other 20%. In addition, providers are also allowed to bill you an additional 15% of the Medicare approved rate. This 15% markup is known as excess billing. You are responsible for these excess amounts billed by providers. There is no maximum or cap on the amount that constitutes the 20% or additional 15% you are responsible for Part B. It is unlimited. Medicare Part C, also known as Medicare Advantage. These are plans, again, offered by private insurance companies approved by Medicare. If you join a Medicare Advantage plan, you still have Medicare. However, you will receive your Medicare Part A and B coverage from the Medicare Advantage plan, not from original Medicare. Part C plans often have zero to low premiums, varying copays, and coinsurance. And we're going to cover this in a lot more detail later in the presentation. Medicare Part D prescription drug coverage, often referred to as a PDP. If your modified adjusted gross income is above a certain amount, just like with Part B, you may pay an income-related monthly adjustment amount known as IRMA. In 2019, PDP plans have a monthly premium ranging from $50 to $160. Some PDP plans have deductibles. The Part D monthly plan premium and deductible is determined by the plan you select. In turn, plan selection is determined by the type of drugs you currently take. We will also cover Part D in more detail later in the presentation.
How and when to apply for Medicare. You have several opportunities to enroll in Medicare. The first is during your initial enrollment period, which begins 3 months before your birthday month and ends 3 months after your birthday month. This initial enrollment period consists of an enrollment window of 7 months. The next enrollment opportunity is a special enrollment period. A special enrollment period is not tied to specific dates, but rather life events. For example, if you choose to waive your Medicare coverage during your initial enrollment period because you were covered by your employer or you were a dependent on an employer-sponsored plan, then you may have a qualifying special enrollment period later on when you finally choose to retire, or if you're simply still working but unhappy with your current employer's plan. You can also enroll in Medicare Part A and B by completing an online application through Medicare.gov or by making an appointment at your local Social Security office, which requires that you call the Social Security office to schedule said appointment. If you're over the age of 65 and previously waived any part of Medicare, your process will be a bit lengthier as Medicare will require proof of your previous medical coverage. If Medicare is unable to verify previous coverage, you may be subject to late enrollment penalties.
This seminar is about understanding your Medicare options. In order to understand the options that are available to you and how to navigate them, we would like to provide you with a deeper insight into Part D, Part C, also known as Medicare Advantage, as well as Medigap or Medicare supplements. Having a deeper understanding of these pieces of the Medicare puzzle will allow you to make decisions about your health care that works for you.
Prescription drug plans. Medicare Part D, also known as the Medicare Prescription Drug Benefit, or PDP, is a United States federal government program designed to subsidize the cost of prescriptions and prescription drug insurance premiums for Medicare beneficiaries. A Medicare prescription drug plan adds drug coverage to your original Medicare. To enroll in Medicare Part D coverage, you must join a plan administered by a private insurance company and approved by Medicare. If you decide not to sign up for Part D coverage when you are first eligible, you'll likely pay a late enrollment penalty later on when you do decide to join the program, unless you have other creditable prescription drug coverage or if you receive extra help. If you are subject to a Medicare Part B IRMA adjustment because your adjusted gross income from 2 years ago is over a certain amount, then you will also pay an additional IRMA fee for your prescription drug coverage. Most Medicare prescription drug plans charge a monthly premium. You pay this in addition to your Medicare Part B premium. Your actual drug plan costs will vary depending on the following criteria: the drugs you use, which can be brand or generic, the plan you choose, whether your drugs are on the plan's formulary, whether you use a pharmacy that is in or out of network, and whether you get extra help paying for your Medicare Part D cost. Prescription drug plan formularies commonly change on a yearly basis. A formulary is a plan's list of covered medicines. For this reason, all Medicare Part D members must reevaluate their Part D plan during Medicare's annual election period, which runs from October 15th to December 7th. Changes made during the annual election period are effective January 1st of the following year.
What is Medicare Advantage or Part C? We talked about this briefly during the components piece. Part C combines the benefits of Part A hospital and Part B medical. Part C is managed by private insurance companies certified and approved by Medicare to offer a plan that is equal to or better than Medicare Part A and B. In California, we've seen that the majority of these Medicare Advantage plans do include prescription Part D premiums. Medicare Advantage plan pros are that they come with a zero or fairly low premium. It also, in many cases, as mentioned earlier, includes your Part D premium. It does not, however, include your out-of-pocket costs that come with your prescription drugs. With a Medicare Advantage plan, there is a maximum out-of-pocket amount, unlike original Medicare, where there are no maximums. On a Medicare Advantage, you have maximum out-of-pockets ranging from as low as $1,000 to $4,800, depending on the plan. But after that amount, you pay nothing for your Part A and B services. These plans also have additional benefits that original Medicare does not offer. Hearing aids or some over-the-counter drugs, as an example, may be included at a discount. So why wouldn't anyone jump up and sign for a Medicare Advantage as opposed to original Medicare? Medicare Advantage plan availability of plans is subject to a network. So not all plans are available in every area. You also will have to navigate bills and statements with various copays, coinsurance, and deductibles up until the maximum out-of-pocket on the plan. Also, since these plans are subject to a network, it means you have limited providers in the network. We often describe these plans as the HMO option of Medicare here in California. You also will need prior authorization for certain treatment, which can cause delays and certainly a level of coordination. Providers and network can also change. They can move out of a plan at any time.
And now we move on to Medigap plans, also known as Medicare supplement plans. These policies are sold by private insurance companies. Supplement insurance can help pay for some of the healthcare costs that original Medicare does not cover, such as copayments, coinsurance, and deductibles. There are a variety of Medicare supplement plans available for members to choose from, where some supplement plans have deductibles and some do not. Two of the most comprehensive supplement plans available are Plan F and Plan G. Cons associated with supplement plans are that you have to pay an additional monthly premium for these plans. Furthermore, supplement plan premiums increase with age, and these plans do not include prescription drug coverage. On the other hand, some of the pros associated with these plans are that while enrolled in original Medicare along with a supplement plan, you will not be subject to carrier-provider network restrictions. This means that you may see any doctor who accepts Medicare assignment. Your medical providers will not have to request prior authorization for referrals to different specialists. Depending on the Medicare supplement that you choose, the plan may pay for your Part A and Part B deductible, coinsurance, and excess charges, thus eliminating most of your out-of-pocket expenses. Supplement plans also offer services that original Medicare does not cover. For details on these additional services, you will have to reference your benefit summary booklet for your Medicare supplement plan. Now that we have explained the different components and costs of Medicare, we'll move on to how these components may work for you. You have three options to consider when signing up for Medicare. Option 1 consists of enrolling in original Medicare, Part A and B, plus Part D. This type of coverage may leave you at risk of having limitless out-of-pocket costs. Option 2 consists of enrolling in original Medicare, plus Part D, plus a Medicare supplement plan. This type of coverage comes at a cost, but it is the best, typically leaves you with a minimal to no out-of-pocket cost. Option 3 consists of enrolling in Medicare Advantage or Part C plan, which combines Part A and B benefits and is managed by a private insurance company. This option is typically the least expensive on a monthly basis, but you want to pay attention to the plan's out-of-pocket maximum to understand what you may be paying and other major bills. Your decision will be based on your personal situation. It is imperative that you understand that all these options are available to you. Taking the time to explore the different options is highly recommended.
A lot of time we get asked the questions, how are you as brokers compensated for what you do? The reason I believe the question comes up a lot is because we do spend quite a bit of time with our clients, and ultimately people want to understand if they're paying extra for our services. Well, I want to put your mind at ease. We are paid directly by the insurance carrier. If you purchase your Medicare plans through us or directly through the carrier, the price to you is exactly the same. Your cost is not impacted at all by using an agent or broker like us to help you. But the benefit from using a broker is that we can give you a cross-section of all carriers and plans offered in your area.
So what should you do next? And this pertains to whether you are looking to immediately enroll in Medicare or a couple of years away. Have a one-on-one with an agent who is AHIP certified. This is the certification that anyone selling Medicare products must have. Both Kim and I are certified each year, and we would love the opportunity to assist you. In addition, Kim and I are certified with all of the top carriers such as Blue Shield, Anthem Blue Cross, UHCARP, HealthNet, and Humana are one of the ones we're certified with. Us being certified with a variety of carriers gives you access to more options and choices. Kim and I are not captive agents. We do not specifically work for any of these carriers. Our duty is to you, our client. As part of our service to you, we will guide you through the Medicare Part A and B enrollment process. We will make sure that you receive a customized options comparison and will ultimately help you make a decision. Once you are ready to apply for coverage, we will walk you through the application process. These applications can be 20 plus pages in some cases. However, there's a lot of information that you may not have to complete. We are familiar with these forms. We will help make this process easier for you. If you already enrolled in Medicare Advantage, Medicare Supplement, or Prescription Drug Plan, or even just Original Medicare, please give us a call. We are constantly evaluating the plans of our current clients and would like the opportunity to evaluate yours as well. You must know that you can switch plans at various times during the year. In fact, if you are not talking to your broker at least once a year, then you want to give us a call. There's a lot more likely than not, there's a plan that is better for you out there. Lastly, we'd like to thank you for taking the time to listen to our presentation. Please feel free to email or call us with any questions. We are happy to hear from you.